Good afternoon, ladies and gentlemen. My name is Dan Pham, and I'm from Oncodea. And today I'm super excited to introduce you to a better way to screen for cancer. But before I get started, I want to ask the audience a quick question. Does anybody in the audience here think that prevention and early cancer screening is a better way and gonna improve cancer treatment outcomes? Excellent. We think the same way. And according to the American Cancer Society data, we can see here that the earlier the cancer detected, the better for the survival but also the financial outcomes. For instance, cervical cancer used to be one of the most common cause of cancer death for American women. But with the use of pap smear and HPV test, the death rate had dropped significantly. But for the other type of cancer, like breast cancer, lung cancer, and prostate cancer, our current standard for screening is still inconvenient, high cost, and invasive. That is why we still have a large population of Americans still not screened for cancer annually. And our solution, we have developed a way to a blood test that can be easily done at home, in the clinic, or at a drugstore. And our cost of goods at the moment is about $50 per test, and is significantly less than our competitors as well as the current standard of care. With just a small amount of blood, it can be shipped to Oncodea for analysis. And the population they are looking to serve is about 70 million women that is recommended by the USPSTF to be screened annually. That would translate into a total addressable market of about $13 billion. We have an incredible team with centuries of experience combined, and we are bonded by the vision of building a world without late-stage cancer, where early detection is accessible and attainable to everyone. Any questions?
So you mentioned a number of cancers that you're focusing on. What are the most kind of critical ones that you're going to start with, and why did you choose those?
Right now, we have a model that would be ready for prospective study. Is it breast cancer? The number one is a very common that women going get screened for breast cancer compared to lung cancer or prostate cancer, even though our platform right now is capable of analyzing and recognize the pattern of lung cancer, breast cancer, and prostate cancer all together. But our focus will be on breast cancer because the availability of serum that we could get from the third-party vendors.
Who would initiate this process? Would it be patient-initiated, provider-initiated? Because even though we know who would benefit from it, who's going to take that first step to actually implement it?
So right now, for breast cancer, you would hear more often that people would, they have the awareness day for breast cancer. People go out and to spread the message that, women, you're over 30 years old, you should go and screen for breast cancer. And so there are already initiatives there, but we still have about 50% of women are not screened for cancer currently. One is probably their distance to the screening facilities. Not everyone got access to closed clinics for these type of tests, and also it's very uncomfortable. If you can see the picture, is hurt for some people, and some would have dense breast tissue, and they have to go back again and for ultrasound or a second mammogram, and so the need is already there. We just want to serve these needs better.
The recent case with Theranos, where they made promises that a small bit of blood would inform on a large number of medical problems. This sounds very similar to that. How do you overcome the skepticism given the variety of cancers?
Of course, we get this question a lot, and I guess number one is we don't drink green juice to begin with, but then we have a very large data from patients. We have over 1,000 patient sample serum, and we get it from third-party vendors like Precision Medicine, Life Sciences, and Proteinics. And they are vendors in this in this industry for a very long time, and we work with them closely, as well as we have collaboration with Dr. Dingley from Mayo Clinic, Dr. Linda Badat from the Dartmouth Cancer Center to validate our platform and for publication coming very soon. So it's all about data and data.